We begin with a new study that suggests that so-called statin drugs, those are ones used to lower cholesterol levels, may actually help reduce the risk of heart attacks in adults who don't have high cholesterol. The Jupiter trial involved nearly 18,000 patients in a long-term placebo-controlled study. They used a specific statin called Crestor.
Half of all cardiovascular events occur in patients who do not have an elevated cholesterol. The Jupiter study shows us that Crestor reduced the risk of CV death, stroke, and heart attack by nearly 50% in this previously unstudied population.
20 million people currently take statins, but they do have side effects that can be serious. So who should be taking these drugs? For that answer to the question and more, we go to Steve Truitt. Steve?
Judy, thanks. I'm here with Dr. Sheliza Shoku. Did I say it right? Mm-hmm. Okay, good. She's a cardiologist at St. Joseph Hospital and a board member of the American Heart Association. Dr. Shoku, welcome.
Thank you.
What are the most important findings here, this study?
Well, the two important findings are that the rate of heart attacks and stroke decreased while they were using the statin drug that they used in this study.
What is the C-reactive protein? We were talking about that a little bit.
Right. C-reactive proteins are what we call acute phase proteins that increase their marker for inflammation. So they increase during an inflammatory process in the body. And that could be a minor infection like a cold, or when there is heart problems, because we do know that hardening of the arteries have to do with the inflammatory process.
So who should be getting this test?
Well, according to this study, that maybe patients that are also at low risk should be getting it. But at this time, the recommendation is that for people who are at the intermediate risk, so that they have family history, their cholesterol is a little bit up, they have high blood pressure, maybe they have diabetes, or blood sugar is...
That's intermediate risk?
Yes.
What's high risk?
High risk are people who either have heart disease or they're diabetic.
Already suffering from those.
Right.
And low risk?
Is age, advanced age. And patients can go, and people can go online, and they can go to American Heart Association, American Heart.org, and find out what their risk factors are and how to assess their risk, whether they fall into intermediate, low, or high risk.
Now, there's a lot of people out there who probably say, I'm in good physical shape, I work out, I take care of myself, but my cholesterol is still high.
Right.
They should obviously still test themselves.
Test themselves for
as part of this study, take a test for higher cholesterol and see if they have artery issues. Right.
But we also know that 50% of people who have heart attacks have normal cholesterol.
Okay.
So, and this study was looking at that people with what we call normal cholesterol, but elevation of the C-reactive protein benefited from decreasing their C-reactive protein level and cholesterol even further.
Is there something that viewers who are watching today can do other than taking medication to help lower the risk of heart attack?
Yes, they need to know what their risk factors are, whether they are at risk for heart disease, and they need to eat well and also exercise daily.
Diet and exercise always seems the case, and have a good relationship with your doctor and make sure you know what's going on. Okay, well, thank you very much, Dr. Sheliza Shoku. Thanks so much.
When you think health, think Eyeroo.